In the heart of Central America lies Guatemala. From the bustling towns and villages to the gorgeous volcanoes and landscapes, these are the people we serve.
My name is Jose Hernandez. I am the team coordinator. I'm working next year, January 2nd, will be 20 years working for Salud y Paz. Salud y Paz, it's growing, specifically help people with health and education. It's changing. It's more progressive for each community. Normal from last year to this year, we have between 12 and 14 teams during the year. But before the pandemic, we used to have 24, 22 teams. The pandemic changed everything. My favorite part of this job is when I'm thinking about I am doing our teams, specifically from United States, medical and dental and construction team. When I see people come far away from our country to help, and people who really need this, like for example, this is the part I love it is to help my own people and be a part of these wonderful teams to see how the health care of people is very helpful for them.
Hi, I'm Christina Metcalf. I'm one of the family nurse practitioners on the trip with Salud y Paz. So Joseph wants me to talk about an interesting patient I had this morning. So I had a little girl, I believe she was 8. She had a motorcycle accident with her dad this morning on the way to the clinic. It appeared that she possibly sprained or fractured her wrist. So we did the best that we could and wrapped it with an ace bandage and kind of talked to them about anti-inflammatory medicines and ice and watching for swelling, and told her that if it didn't get better that she would need to go to the clinic for further evaluation. So my favorite part has been, just caring for the beautiful people of Guatemala. What is shocking to me the most is how appreciative they are of the little things. The kids love when we give them crayons. They act like that is the best thing they've ever gotten. Yesterday evening, I had a couple that came up to me and they wanted some lotion. They'd seen some of their friends with lotion and I gave them lotion and they just all had big smiles from ear to ear. So just the blessings that we can give to the people.
Hello, my name's Hannah. I am originally from Arkansas, but now I live in the Nashville, Tennessee area. And this is my first time to Guatemala on a medical mission. I have been on other medical missions to Panama, Nicaragua, and Costa Rica, but this is my first time as a provider getting to come to see patients. So I'm a family medicine physician assistant. And I work in primary care in the States, so now it's been fun. My previous trips I went on, I was a student, so I mostly took vitals and did triage, so it's been fun to get to actually see and treat patients, seeing a lot of abdominal, GI things, skin, headaches, vision, diabetes, blood pressure, a really good variety, but it's been just super sweet to get to serve the Guatemalan people because they're so joyful, so grateful, and we've had an awesome team from the States with everybody that's come, but also the translators and our team from Salud y Paz are just phenomenal. I mean, the Guatemalan people are so kind, so grateful, like I said. I would say one thing that's different that I've noticed about Guatemala versus the other Central American countries I've been to is it's more mountainous. Like, I haven't seen volcanoes in other countries. I feel like we're up at a higher altitude than what I've previously seen. So with almost every patient I've seen has headaches frequently, and so I'm consistently trying to encourage them to drink more water and talking about hydration and the importance of that. But yeah, I think that just everyone that I've met here, all the patients we've seen, like I said, are so kind, so grateful. They have really tight-knit families. They take great care of one another, and they genuinely want to be as healthy as they can be. So it's just a blessing that we get to bring them some access to medical and dental care while we're here.
One day over lunch, a small group of us went to visit this family that we had the privilege to meet last year. It was two sisters that both were completely unable to walk, move their legs, and barely can move their hands. Their grandma has to carry them down the mountain every day just to go to the bathroom. And they live in a small house, barely anything. Their bed was just blankets. Their floors are dirt and their walls are dirt. But they were really, really happy to see us. They both had big smiles on their faces. They were super glad that we could bring them just a little bit of medicine that we could get in the US easy. And they can't get it there because how remote they are. It was really exciting to see how happy and excited they were for us to be there. The two sisters, we all said a prayer for them, and they all just started to pray along with us. And it was also one of the girls' birthdays, so there were balloons hanging up on the wall, and they were celebrating. So we went back to our station and got some coloring books and pencils to bring back to her, and she was really excited about that.
I'm Reverend Janice Sudbrink. I have been coming to Guatemala for about 13 years. On Monday, our first day in clinic this time, I saw a gentleman that has had this huge tumor on his spine for about 15 years. He came to us asking for help. The only thing we could really do for him is to give him pain medicines like Motrin and Advil and things like that. But sadly, he will probably not ever be cured, but at least we reached out to him and gave him something to hopefully, help with his pain. So Salud Paz is very important to us. We came to love this organization when we first came down here. It was a leap of faith to come. It was a group in Little Rock at the First United Methodist Church in Little Rock that told us about this trip. And we met with them and they told us all about it and told us exactly what to do. So we came down here with just the faith of knowing that, things would work out for us.
My name is Carmen Cobb, and this is my second year to come to help with Salud Paz. And my job is to help in the lab or triage and entertain the kids. I really enjoy what I am doing because it's a bless for me to see these beautiful smiles and happiness in every children that we see in here in Chichicastenango and around the Chichicastenango. My favorite part in here is to see these beautiful people and beautiful kids and to help them. And when they ask, for a Crayola, they make them so happy to give them something to coloring and to help them. And the most beautiful thing is the kids, they cared a lot for her parents because one day, a boy, he asked me if I have sunglasses. And I thought, they are for you. And he said, no, the sunglasses, they are for my mom. And that really touched me.
Hi, I'm Haley. I'm the long-term volunteer for Salud Paz. I've been here in Guatemala for about almost a year and a half now. I'm originally from Texas, and I graduated in public health, from the University of Texas, and then I decided I want to do international medical work. So I found a job opportunity in Salud Paz and moved down here. So I've been working with the teams and working in the main clinic for as long as I've been here, and it's been absolutely amazing. I love the people here. I've had an amazing experience living in Guatemala. It's changed my life. The culture is so beautiful. All of the people are so beautiful, and it's truly like such an incredible thing that I've been able to been able to live here and live amongst all my Guatemalan coworkers and all the people I care about so much, and be able to also help all the teams and meet all these awesome people from the U.S. who have come to help and support, which we appreciate so much, all the help, because it's definitely needed here. Hello, this is one of our translators. Her name is Mary, and we're going to ask her a few questions today. First, how long have you been working for Salud y Paz?
2 years.
And what do you think about it? Why do you do it?
Pues ese trabajo que hace Salud y Paz es muy interesante. Apoya a muchas personas que no tienen la capacidad de ir a una clínica y que puedan comprar sus medicamentos.
So, like, what do you do outside of Salud y Paz?
Yo soy estudiante de la universidad, estoy estudiando la carrera de trabajo social.
When we work in the clinics, often our patients don't speak Spanish, so we have to have translators who speak Quiche Spanish and a little bit of English to help support our groups. So Maria speaks some English, Quiche, and Spanish. So she helps us translate to make sure that all of the patients know exactly all the instructions that we give and to help with the communication.
Hello, my name's Gayleen. This is my first mission trip to Guatemala. I'm a triage nurse this year, and many blessings from them. This is our second day of clinic, and I think I've triaged about 45 patients already. A lot of surprises, actually. Just the gratitude of all the people that we've seen, and the gracias, and how they're thankful to us, but yet I'm the one that's getting the blessing from that. And something that specifically sticks out to me, and probably I will be in my dreams for many days to come, is a gentleman that came to us, no family. He's alone. He walked bent over with a cane. He has a large mass on his back, on his spine, and of course he's in a lot of pain. Of course here, we're kind of limited on what we can do for him, maybe some Tylenol for pain, and hoping that in August, when the general surgeons come to Guatemala, that maybe they can give him some relief. But it was very touching to see him walk away, and with limited abilities to take care of him.
Hi, I'm Laura Shearer. I have the privilege of serving as the executive director of Salud y Paz. So my journey began in Guatemala, it's got to be 18 years ago. I had no idea what was in store for me. I came as a volunteer, really didn't have a lot of, I would say, transferable skills, but I think God had a plan for me. I was truly humbled by the opportunity to work alongside Guatemalans, building houses, roasting coffee, working in coffee plantations. Then I got into mission work and began to see how really the power of mission work, working alongside Guatemalans, can have a long-term impact. Really, 18 years later, my life has been the life that has been probably changed the most, and I'm truly humbled by really the trajectory that my life has gone on. What I see about Salud y Paz that I think sets it probably apart from, or really makes it unique, and what I really value about Salud y Paz is the value of working together with the local communities. working, most of our staff are from the local communities. We work together with representatives from our local communities. We value their voice, and we have kind of a view to the long term of how we want to empower and strengthen them to be making their choices, to be making the changes we need to be empowering them for the health and education for their long term. And that's something that I really see that is a strength and a value of Saluti Paz that I admire, and I feel really proud to be part of that. I think that the mission team at Saluti Paz works very much together with its core programs run by its local staff. And I see that integration is very key. And I think that's something that we have to be proud of. So thank you for watching this. Thank you for being part of who we are. Thank you for being part of our greater community. There are many ways in which our community supports our work. One way is coming on a mission team, but it's not the only way. You can be part of our work by supporting our monthly giving program, by becoming a child sponsor, by supporting our work by liking us on social media, by praying for us. So there's many ways in which you can support this work and be part of our community year round. So thanks for your time.